Hi, welcome to the Osteopathic Center podcast, and happy holidays. We're toward the end of the year now. I wanted to go over today a bit about what we do at this clinic for pain. Now, we have traditional approaches, we have integrative approaches, we have regenerative approaches, and it's a matter of just understanding how many different ways can pain be treated. Obviously, there's conservative ways, there's minimally invasive with injections, and then there's what we don't do here, surgery, and that you can always go that route. So I'm here to kind of go over what does this clinic do. So I kind of wanted to present what is in our procedure room, and that's why I'm here, and we'll kind of go over things that you see in this video as the time goes on today. Now, I'm going to go over conservative things first. Of course, as doctors do, we train traditionally, so all of us train in how do we treat somebody's pain. Well, let's go to physical therapy and let's give some type of pain medicine, whether it be traditional NSAIDs that you do over the counter like ibuprofen or Tylenol, or maybe it's prescription that are much more strong, and then we even get to steroids. And so those are things that all of us can do at this center, but so can every other doctor. And the point of coming to this clinic is knowing that we can treat things in other ways. And a lot of what we do is treating it to heal you rather than just take your pain away. But let's go over a couple more conservative integrative things. This cream is a homeopathic cream. It was actually put to a test against a very popular pain cream that's out there, and called Voltaren gel, and it showed that they were similar in efficacy, but difference, this has no chemicals, and this has no smell, so people that are sensitive to any of that type stuff, this is an extremely good pain reliever. Another cream we have, sorry, I didn't say the name on that, it's called Traumeel. It's out of a company called Heal, and it's from Germany. Now another cream we have is called Real Time. Real Time is a mixture of homeopathics as well as herbals. And so we're trying to get the best effect. Now this does have some of the capsaicin in it, so you do get that warm feeling, as well as some other herbals, so you get a strong smell with this one. But some people, a lot of people don't mind that, and they use this. Many times I'll actually mix these two together, and you can apply them and get a double effect. Now there's lots of different herbs and pills for pain. I'm going to point one out in particular because this company I really do like, called Fusionary formulas. This lady got her PhD in Ayurvedic medicine, got her thesis in turmeric and into the curcuminoids, and she imports these herbs from India and actually tests them, makes sure they're all clean, and then puts them in here and isolates and really puts them into, in particular, this one's an inflammation relief. So we get different herbs to give you a decrease in inflammation and therefore give you pain relief. And we have more, she also has other products that are more specific. Then the last one I want to point out in this clinic is a natural pain patch. And this thing has been extremely effective for people. It's made of herbs only, phytoplankton, ginseng, silver, and germanium. No chemicals at all. It does work really, really well. Downside is the adhesive's not great, so we'll see it come off a bit. But these are just very conservative things we can do, from just hey, come in, get some products that are not going to react with almost anybody, and so we can just put somebody on this and just see if that's going to take care of your pain. Now, something else we do in the clinic, is called osteopathic manipulation, and there's a few of us in the different offices. There are 3 different offices, in case you don't know. There's one in Knoxville, Tennessee, there's one in Jupiter, Florida, and then Miami, Florida. And so some of us do this osteopathic manipulation. It's alignment based, and it's using, most of our techniques are soft techniques, craniosacral therapy, fascial techniques like myofascial, neurofascial, counter strain, muscle energy. Not so much of the cracking and popping in my clinics. But we use those types of treatments to try to help relieve pain. So those are some mild things. Now we have some modalities. I have a Biophoton, which is a laser machine which can help relieve inflammation and pain. A pulsed electromagnetic field machine, which is extremely effective at working on the mitochondria and helping pain, and also in getting the body back to functioning better. And then a point and shoot cryotherapy, not the walk-in one, but if you have an injury right to your elbow, point the cold air right at it, and that is very effective. All of these kind of supplements, the manipulation, as well as the Biophoton laser, the Cryotherapy, and the PEMF machine, pulse electromagnetic field, they just need to be done multiple times. It's not something where you're coming in one time and that's it, boom, your pain's gone. You have to do it usually anywhere from a few times a week to at least once a week. But that's a good way to start, and a lot of people prefer that. Let's start at the bottom and work our way up. But what happens if those things don't work? Well, then we definitely need to get a proper identification of your problem, and we'll go into this in the future, and there's some other podcasts that we'll talk more about this. But proper identification is through physical exam, so being very well trained. For example, Dr. Morse in our office is fellowship trained in sports medicine. I've been in family medicine and through the sports world through other means and manipulation and trained in other things. And then other practitioners in my clinics have also been through their own specified training. But I kind of direct how most of these regenerative and integrative treatments go. So that way it's a top-down approach here, and I've had experience in doing these for about 11 years. But if we can utilize other things like imaging, x-rays, MRIs, as you see there's an ultrasound right behind me. Me and Dr. Morse are very, very well versed in the ultrasound, and we use it for diagnostic purposes as well as injection purposes. And then on the other side, there's a CR machine, which is used to x-ray guide injections as well. And so it's just using all of our resources in order to get the proper diagnosis, which gives us the best opportunity to give the best treatment plan. So now we get into a little more aggressive ways we can treat, and these are injection therapies. Of course, you have your typical anti-inflammatory injections, you have your steroid injections that, like I said, every doctor can do. But we get into some more integrative natural things. The integrative injections are getting into the same as the cream. There's actually a injectable called Traumeel, and it is a natural way to get rid of pain. And so we can do that injection for any kind of inflammation. The other is called a Prolozone injection. That's where we take ozone gas and actually use it to inject at a point of inflammation, and it's extremely effective at taking away pain and inflammation. And so these are just a couple extra little tools in the toolbox that we can use to get people back into a better position and place. Now, something more mild like trigger point injections we also do, and that can be with steroids, or it can just be with an anesthetic. And the anesthetic can be a short-acting or it can be a longer-acting anesthetic. With the ultrasound, we can also do nerve hydrodissection, where if we think there's an entrapment neuropathy, then we need to open that up and take pressure off the nerve. Now, when we get into our more specific musculoskeletal injuries causing pain, or chronic degenerative issues causing pain, such as arthritis, then we need very pinpoint, accurate injections of these areas in order to get relief. For example, this is a knee. This is your quad tendon, your patella tendon. The medial side of the knee has your medial collateral ligament. Lateral side of the knee has your lateral collateral ligament. This is your tibia, fibula, and femur. So this blue right here is your meniscus. So if we have an injury to the MCL and we do a joint injection, we're not going to be getting pain relief for the MCL. We have to direct our injection directly to that area. And that's where ultrasound comes into play, and also palpation skills depending on the area. Because some areas we can't look with our imaging, and we must know our anatomy well enough in order to inject. But if there's a meniscus injury, injecting into the joint, very easy. A lot of doctors do it, but that's where we would go with it. The difference is understanding how the integrative approaches work with our pain and with our injuries. The reason a lot of doctors can do steroids and other types of anti-inflammatory, because in residency and training, what do we do all the time? We go over this over and over and over. We don't see too much Traumeel injections, ozone injections. These aren't things in our residency program. So when we go to courses after our training, that's the key. How do we get the repetitive work in order to know how these will actually affect you? And that's where this clinic is extremely effective based on our history and training of these different types of treatments. So the integrative approaches are Traumeel, as well as ozone for different types of pain and inflammation. Now, then we get into our regenerative approaches. So we have, first of all, Prolotherapy, and Prolotherapy is using a dextrose solution. And that dextrose solution, let's go back to our MCL, for example. We inject it right to where the injury and tear is, and it creates an inflammatory response. That response rushes blood in, creates a healing effect. Now, it's a very mild healing effect compared to other types of injections we have. And it also depends on what type of chemical is used in prolotherapy, as there are many different ones out there. But the most common is dextrose. And so Prolo, whether it be an MCL, whether it be a foot, we have our plantar fascia, very common injury right there that a lot of runners get, and as we get older, creates much more problems. We get inflammation in this fascial area, injecting that area. Achilles tendonitis is a great one. Now, something traditionally that's a little more effective is called platelet-rich plasma or PRP injections. And the original research was done with plantar fascia as well as in the elbow. And now we've seen it researched over the whole entire body. But platelet-rich plasma is taking part of your blood and then spinning and enriching and getting the best part of it out, getting your platelets and growth factors out of your blood in order to re-inject to incite an acute inflammatory response. That acute response will start the healing response that your body naturally does after any injury or even after surgery. So your body, if we can recreate that response, we're going to heal the tissue. In both of the treatments, prolotherapy and platelet-rich plasma or PRP, they're trying to get your stem cells activated in order to regrow tissue, because ultimately what regrows tissue is stem cells. Now, that brings us into a stem cell class. Now, the terminology has definitely gotten overused, and unfortunately, now we're finding that it doesn't mean quite what we thought it used to mean. And I did a podcast with Rich Froning years ago and kind of talked about this, and we're finding more and more research shows that this is the case. We're finding many more tissues have what we call tissue-specific stem cells. So whether it be this ligament here, whether it be the meniscus, whether it be the tendon of the Achilles and the plantar fascia, each tissue or organ systems even, like heart and liver and brain, if we can activate the stem cell in each of these tissues, then we can actually make the tissue regrow. So that terminology from a stem cell, and the particular one that's been referenced is called mesenchymal stem cell for musculoskeletal issues, is now being termed a medicinal signaling cell, because the cell we're injecting actually signals the tissue-specific stem cells to activate. Now, we have different ways to get this and inject this. Two are from you. One is taking your adipose tissue out. We remove the adipose tissue and then break it down, not with enzymes, as the FDA has frowned on that, unless you're in select research studies. But we break it down mechanically, and then we use your blood to help facilitate that, and then we can re-inject that. And that is an excellent source of those cells. The other is getting it from your bone marrow. So if we get it from your bone marrow, the best place is from your low back, and it's actually part of your hip actually. But we have to go into the hip here and pull this out in order to get what we need out of that bone. And there's different ways to do this. One is taking this out, spinning it down and concentrating it. Another is taking this out and actually using what we call whole bone marrow, because when we spin it down, we do lose some proteins that are very valuable in the healing process. So very important that both to understand that both bone marrow and adipose work extremely effectively for many musculoskeletal injuries. Now, there's also stem cell or medicinal signaling cell treatments from other people, and those are amniotic, whether it be amniotic fluid, whether it be exosomes, or whether it be umbilical cord, and more specifically it's called Wharton's jelly. That's where the cells are. There's no cells in the umbilical cord blood. So that comes from third parties, and those facilities work with the FDA, and they work with the specific hospitals in order to make sure they get the best products. They're all tested for anything, even if you were doing surgery with one of those things, these products get tested for the exact same to make sure they're extremely safe There's no problems with the products themselves, and there's no diseases with those products. And then we get those, they're frozen, we get them shipped to us on dry ice, and we either put them in a -80 freezer or we just use them the day of, unthaw them, and we can apply that treatment. And then the last one is called a tissue graft treatment, and it still falls under this stem cell umbrella, because a tissue graft is just like doing a mini surgery. Let's say we needed to put a graft into your ACL here, right? But what if your ACL wasn't completely torn? What if any tissue wasn't completely torn? Well, if we can inject a graft, and that's just little bits of tissue, if we can inject it into the area, your body can use it as a scaffold to build new tissue on top of. And that way we get a physical way to actually build new tissue as well. So I have seen all of these products work. It does depend on the type of injury, the severity of the injury, and what we're actually trying to treat. And also, are you a candidate for each of these treatments? There are things that do disqualify people, cancer being, I mean, the most common one. If you have cancer, we cannot do PRP, we can't do bone marrow, we don't want to do adipose, because we don't want to risk moving the cancer from one area of your body to another area of your body. But I just want to go over in general about what we do here. And so going a little more to using imaging. So for example, the ultrasound, we can specifically look at this ultrasound, with this ultrasound, and look at the MCL. We can look at the patella tendon, the quad tendon. We can see the severity of injury, and we can guide the needle directly to that. Same thing with the foot. We can look at the ultrasound, directing it right to the plantar fascia, looking for the area focus of injury, so it's very precise. Regenerative medicine, that's what, if I get anything across today, is that regenerative medicine needs to be done very precisely to get excellent results. Otherwise, I've seen a lot of people, I tried that, it didn't work. Well, I asked where it was injected, it just wasn't done properly. So we have to know exactly where the injuries are. It gets more complicated with the spine. And as you can see, I want to show you the whole spine, and this is half the spine, because how the pelvis and the sacrum and the lumbar spine connect together is very important. And if we miss some stability markers here, maybe there's one level giving a problem, but stability doesn't mean always just one level. It can mean the whole area. And so as we get more specific, we can hone in to the ligaments that go in between these vertebrae and from each vertebra. And there's even ligaments that go from the pelvis into the vertebra as well. And to get precision is the key, even more so with spines than any other part of the body. It's easy to look at a plantar fascia, say that's the injury, that's the pain, let's inject it. Not so easy with spines. So it's all about precision. Now, this other machine is called a fluoroscopy machine behind me, and it's also called an X-ray guided machine. So this machine is used particularly by pain management specialists, neurosurgeons, and other people who have had in-depth training. So we do have, this is not something that I do personally. I do have other doctors who come in my office, and we can use this machine to guide into your spine. And now this, we can guide directly into a disc, as we're finding some decent results through the early research of disc injections with regenerative medicine. Or just to take pain away, ozone is great at injecting into a disc and taking pain away. But it's also, once again, finding, is the disc the problem or is the pain coming from somewhere else? So once again, we get back to that diagnosis question. And the most important thing, no matter where you go, is making sure your diagnosis is proper. And after that, then we can talk about these different treatments, whether it be the conservative treatments with creams, patches, whether it be medication treatments, traditional approaches with anti-inflammatories or steroids, or then we get into the integrative once again, the Traumeel, the ozone, Prolozone injections, or we get into regenerative, Prolotherapy, PRP, or the stem cell, medicinal signaling cell, bone marrow, adipose, amniotic, exosomes, Wharton's jelly, or tissue grafts. And I just want to give you an overview of what our office does and what we can do to help you. We have a lot of different tools, and it's just a matter of figuring out what's right for you. And that starts with just coming in and having a discussion and an evaluation. So welcome to visit our website, www.theosteocenter.com. Check out our Instagram, and give us a call if you feel like we're the right place for you.